We are knowingly harming patients through the use of off-label materials like tape and tie. The patient airway is a vital life-saving piece of equipment, so there should be something fit for purpose, designed and regulated to do the job. We were quite shocked to find that there's no advice from any of the major associations involved with anaesthesia or airway. There's nothing beyond the airway should be secured. They don't say anything about how do you secure it, what materials do you use. Now we have Leafix, we're at least able to standardise the product that's used to secure the airway.
We used to use the tape, which we just kept in our pocket, so it would get quite dirty and dusty, get fluff on it and all sorts. So really it wasn't a clean way of securing airways onto a patient's face. And obviously it's not designed for that purpose, so it'd be quite hard to get off the patient afterwards as well, especially with the heat of the body. And sometimes you would get movement of the tube or the airway as well, maybe during the case, so it wouldn't give you a very secure seal.
There's issues with injury to the lips, particularly the edges of the lips. Patients, usually when you take the ET tube out, have got really red marks, and it takes quite a long time for them to disappear. We've always just gone along with what was on offer, the tapes, and I've never actually questioned whether there would be anything dedicated for airway management.
I found the Leafix a very good system. It's obviously a dedicated design. It's easy to use, it peels off the back and nice and easy. It secures to the face well. You can wrap it around the airway quite nicely. You can split it if you need to, and it doesn't leave marks on the patient.
It just fits onto any face. It adheres well for patients who've got beards, facial hair. It's never too long or too short. It's just purpose-made for the airways we use.
The material of Leafix seems so gentle on people's skin, and I've never heard of anyone having a reaction to it. So no marks left on people's faces, and yeah, they probably would never know they even had an airway in.
Just see how good it is, how well it works, see what the outcomes are like for the patients after surgery.
And particularly if there are cost implications for the hospital, people can be a little bit wary, but I would say give it a go and I'm sure you will be converted.
And you may find that the ease with which you can use low flow anesthesia, there may be some cost savings in securing the airway in the way Leafix would help do.
You cannot put a cost on patient safety, and that's something we're looking to address with the use of Leafix. We have an online training portal where we highlight all the different types of airway that Leafix can work on, as well as all the various surgical positions such as lateral and prone. So our team will come in and educate people working in theatres, be that anaesthetists and ODPs, not just on how to use Leafix, but also on how to improve practices in airway security.